When we talk about cancer, most of the attention goes to the disease itself. But for many patients, what makes the journey truly difficult is not only the tumor, it is also the side effects of treatment. Severe fatigue, loss of appetite, weakness, and the inability to continue medication can make cancer therapy much harder to tolerate. So an important question comes up. Could a natural substance help patients better cope with treatment? A clinical study on patients with advanced kidney cancer explored exactly that question, and the substance they investigated was royal jelly. In this study, researchers focused on patients with advanced renal cell carcinoma, a type of kidney cancer, who were receiving targeted drugs called tyrosine kinase inhibitors, or TKIs. These drugs are still an important part of treatment, but they often come with frequent side effects. Patients may experience fatigue, anorexia, digestive problems, mouth inflammation, skin-related symptoms, and other treatment burdens. And when side effects become too severe, doctors may need to reduce the dose or even stop the treatment altogether. That is a serious issue, because keeping patients on therapy is often essential for the treatment plan. This was a randomized, double-blinded, placebo-controlled clinical trial, which means the study was designed to reduce bias as much as possible. A total of 33 patients were divided into two groups. One group received royal jelly capsules, while the other received placebo capsules that looked and tasted the same. The capsules were taken for 3 months, and the patients were monitored every 2 weeks for symptoms and laboratory findings. The goal was to see whether royal jelly could reduce the side effects caused by these cancer drugs and help patients stay on treatment longer. The results were especially interesting in two areas: fatigue and loss of appetite. Patients in the royal jelly group experienced significantly less fatigue and significantly less anorexia compared with the placebo group. These benefits were even more noticeable in patients who were treated with sunitinib, one of the commonly used TKIs in kidney cancer. Another important finding was that patients taking royal jelly were able to continue their treatment for a longer period without dose reduction or treatment discontinuation. In simple terms, royal jelly appeared to help some patients tolerate therapy better. Now, it is important to be accurate here. Royal jelly did not improve every side effect, and not every blood test result showed a significant difference. But reducing fatigue and anorexia alone can make a major difference in daily life for people going through cancer treatment. In cancer care, it is not only about how powerful a drug is. It is also about whether the patient can stay on the treatment and maintain a reasonable quality of life. If fatigue and appetite loss become overwhelming, even an effective therapy may become difficult to continue. That is why supportive strategies matter so much. This study suggests that royal jelly may have value not as a replacement for cancer treatment, but as a supportive companion that could help certain patients better tolerate therapy. So what is the real takeaway from this study? Royal jelly showed promising protective effects against some treatment-related side effects, especially fatigue and appetite loss, in patients with advanced kidney cancer receiving targeted therapy. It also appeared to reduce the likelihood of early dose reduction or discontinuation. But this was still a small preliminary study, and the authors themselves emphasized that larger clinical trials are needed. So the message is not that royal jelly is a cure. The message is that bee products may have a meaningful place in supportive care, and science is beginning to explore that possibility more seriously.